get started. First of all, we're going to do an overview here of some of the things that we'll cover today. We're going to talk about our Regional Health Authority, our health line that's in place here in the province. We're going to go over a few questions about medications, housing, transportation, helpful agencies that are around and different support systems, and of course, what we offer here for community resources. First, I'll talk about our Regional Health Authority. Newfoundland and Labrador is divided into 4 health regions where care can be accessed. And each of these regions have a website which you can access. And the website will include information on their programs and services, frequently called numbers, and facilities. The Health Authority websites are very detailed and provide any and all information that you would need. And if you can't find it on the website, they do provide phone numbers there, so you can get in contact with some sort of intake worker, assessment, or case manager to kind of guide you with those questions. So the Regional Health Authority, for us, it'll be our Eastern Regional Health Authority. It'll provide entry point into the health system. So this entry requires an assessment, and it helps you identify the appropriate services. You can go ahead. To meet your needs. So after the assessment process, it will see where you are with the diagnosis of the disease and what your care needs are and what you may need at this time. So it will assist you in receiving the community services you require. They'll be very knowledgeable in the community services which are available in the region, and they'll be able to refer you to these services and give you phone numbers, emails, contact information right on the spot, because that's what they're there for. And they maintain ongoing contact with you as well to ensure that your needs are met, because your needs are going to change over time. So these assessments will be a continual process, maybe a yearly thing, and each time you may have different needs. So it's good to keep in contact with them, and they will make sure that they keep in contact with you. So the entry point are for the following services. Like I mentioned, the case management, so home care services as well are listed there, nursing, personal care, nutrition, and individual funding. They'll be able to get into those specifics a lot more with you and be able to look at your medical history and your current care needs and see what the wait times are maybe for personal care homes in your area and things like that. So they're really that frontline person that you're going to be able to work with to hopefully get you connected to the right services that you need. They'll also know of day programs, maybe Meals on Wheels services, and different things like that in the area, which could help you as a caregiver with respite needs and things like that. The long-term care services they'll also have a lot of knowledge on around connecting with a social worker for the assessment for considering placement, talking about occupational therapy and physiotherapy in these centers as well to maintain a good quality of health and things like that while residing at one of these care places. So your Regional Health Authority will give you community resource information on personal care homes, which are in your region, which would be suited for the individual's care needs. Assisted living, because that may be the option or the stage that you're at. Respite options, and private care agencies. So these are all great bits of information to have when you're planning for your future and things like that. It's really ideal to work with a case manager within your Regional Health Authority to ensure that when the time of placement comes, you have knowledge of your options, and you hopefully have already began an assessment and working with building a caseload with them so they know what your needs are, where you reside, and hopefully are able to help you transition into whether it be the personal care home, an assisted living situation, or working with a private agency. They'll have a lot of knowledge on you and your relationship with your loved one who's been diagnosed, and be able to hopefully positively move forward with helping you get connected to these community resources. Newfoundland and Labrador Healthline is a really great service which is provided 24 hours a day, 7 days a week, 365 days a year. It doesn't just have to be for necessarily Alzheimer's disease or related dementia questions. It can be any sort of health concern that you are having at the time. You can pick up the phone, and it's professional health advice from an experienced registered nurse. So they have a 1-888 number there, and they also have a website which you can access. And I simply use that line when I know I can't get into my doctor for a few weeks. I can pick up the Healthline number and be able to talk to someone right away, because it may be something that maybe I can wait on an appointment, but if I just had this one question answered by a nurse now, I'd be able to deal with what's going on and hold off a bit. So it's always nice to keep that number on hand in case anything does come up, even after hours and things like that. Because like I said, they are 24 hours a day, 7 days a week type thing. So questions about medications.
There you go.
Thank you.
Oh, sorry.
That's fine. Yeah. So to talk about questions about medications here. Of course, contacting your family physician or the specialist that you might be working on who prescribes the medications is the first and most ideal point, because they are the physician who would prescribe that and would have the most knowledge. But if you can't get to your physician, like I said, in that timely manner that we all wish we could, it's always good to contact your pharmacist as well, because they have a great knowledge on these prescriptions as well, and how they would maybe work together and things if you were having concerns around that. And then if you're just looking for, say, information on Aricept and these different medications which are being prescribed for Alzheimer's disease or related dementia, we have plenty of information sheets actually at the back of the room there that are specific to each of these drugs. So it would give you a detailed outline of how the medication works and maybe side effects that it would have and things like that. So if you ever wanted to get a copy of any of those sheets, then you can always ask us, and we're more than willing to provide those. And I'm sure that the Healthline may even be able to answer a few questions on medications, so don't rule that one out either. So under more questions about medications, I've listed the Newfoundland and Labrador prescription drug program here. And I also have a brochure up front here on that prescription drug program as well, if anyone would like to take that one away today. And I said here that the NLPDP provides a financial assistance for the purchase of eligible prescription medications for those who reside in the province. Now, there are requirements that you have to meet to be able to avail of this service and things, but I do like to list this here, so if you wanted to gain more information on that program, you can contact their assessment clinic by their toll-free number, which is listed on this slide here. And also the brochure that's up here would probably have a bit more information as well. So to speak about some housing options here. Living in our own home for as long as possible has become the most ideal situation here in the province, because as we know, there are not enough care beds in place for the individuals in the province who are in need of them at this time. And actually, for an individual who will stay at home for at least a year of time more out of these care homes will result in a savings of about $50,000 for that family. So that can be quite significant, especially if anyone is in any bit of a financial situation or anything. Self-contained units and supported independent residents are also a great means of living, because you do have that independent side still where you reside in your own apartment or your own room and things like that in a complex. So you do have a bit of support there, but you still have that bit of independence because you can still function in your day-to-day living and be able to support yourself in your own unit or in your own room. Our personal care homes as well are a great option for housing, and that is for planning for the future when care needs are increasing and considering options for care and things like that. So I printed off a sheet for this one here because they actually had a great description on their website. It says, as we age, most of us would prefer to live in our own homes for as long as possible. I can definitely agree with that one there. The Canadian Mortgage and Housing Corporation can help make that possible by showing you ways to adapt your home to meet your changing needs. So you can find out more about home adaptation types, modification strategies, and the financial assistance that's available to help low-income households undertake home adaptation programs and projects. So this is for persons with disabilities, home adaptations for seniors who care needs are increasing, and to install things like safety bars and all sorts of things like that, so that you are able to live a good quality of life and live safely in your own home for longer. So I listed the website there, and they do have a few phone numbers and things like that, which you can get from there. So if you had any more questions about that, that's another great community resource that's out there, which if you do meet those requirements, you can avail of those services. So the Go Bus is a really new exciting thing which has come up here in the St. John's area, and it's a really great means of transportation for persons with disabilities and those who are unable to access conventional transit and equal access to a transportation system. So some individuals may have mobility issues and may not be able to simply take a metro bus or anything like that. So the Go Bus is accessible transit, which would provide them with a means of transportation that is to their mobility needs or their care needs. So this one here can be accessed by simply calling it, and it's at the number listed here. I know I was just at the City of St. John's Seniors Day, and the ladies there love the Go Bus. They were stopping me, they're like, can you call the Go Bus to come pick me up? And just give them your name and they know where you are. They came right to St. Teresa's Parish Hall and picked up the few ladies that were there and stuff. So it is a really great service, which a lot of seniors and different individuals with disability needs and Alzheimer's or related dementia individuals do avail of to get around town and things. So I like to list helpful agencies here on a government level to speak about our Office for Aging and Seniors. The Office for Aging and Seniors works with other government departments and agencies to promote healthy aging across the lifespan. So this would not be something that, say, you would contact about an individual situation. This is more on a larger scale. If you're looking to have something changed in the province or a question answered on caregiving and things like that, or what's in place for healthy aging programs and things like that. I like to list it though because it is the Office for Aging and Seniors, and it is where a lot of help for these community resources that we're talking about comes from. So it's nice to know that this office is in place and it is working to better living conditions and better community resources, and they're putting lots of funding into lots of great programs so seniors and even individuals who are in their 40s and 50s with Alzheimer's disease and related dementias are able to access these different community resources and services. And they're doing a really great job of really connecting all those programs and bringing it together. They like to, they have this special assistance program as well, and this program provides basic medical supplies and equipment to assist with activities of daily living for individuals in the community. Excuse me. So to qualify, the individual must first meet financial eligibility and have a clinical assessment completed by a nurse or a social worker. So this is just another a program which government does provide. And for more information on this, you can, of course, contact this number here. Today's session is about letting you know what is there in resources and providing you with the basic information on all of these programs. So hopefully we'll get your interest piqued, and you'll be able to then explore some of your options and things like that which are out there.